worsening during pregnancy due to the fact that, again, as I said, it's an emotional turmoil for women, psychological, social stressors, hormonal stressors. So it is very important, very, very important to keep following with a psychiatrist and a psychologist. And actually, psychology, the therapy becomes very important in pregnancy because you can actually get a significant amount of treatment for depression, anxiety, and some other psychiatric diseases with therapy alone as well, especially during pregnancy. So that is very important. Uh, Now, for postpartum, again, depression, if someone has it, the warning signs can be feeling extremely hopeless, not getting happy about the baby at all, not even touching baby, uh, feeling not able to sleep, not able to eat, crying spells that last all day. So these are some of the red flag signs, and most importantly, having suicidal thoughts of not wanting to live. These are very important. The treatment, just like other depressive illnesses, it would be combination of psychopharmacology, medications, and psychotherapy. Medications, again, I would not like describe the exact, but the classes would include the SSRIs, your day-to-day Zoloft, Prozac, escitalopram, sertraline, fluoxetine, SNRIs, duloxetine, venlafaxine, atypical antidepressant, and therapy. Now, again, we have to be careful because the symptoms may not respond to these medications right away. For any psychiatric illness, if you put someone on SSRIs or SNRIs, it will take at least 2 to 4 weeks for patient to notice any significant difference, unless it's a placebo. That it can never scientifically happen that you give an SSRI to a patient who's severely depressed and next day patient says I'm cured. It's placebo because these medications do take this much time to build in your system. And hence they have to be taken for at least certain amount of time. That's another big misconception that people think, okay, I am depressed. I take a medication for 2 weeks and I'm fine, leave medication. No, please don't do that. And as doctors belonging to any specialty, especially psychiatrists, we have to tell them this psychopharmacological counseling is maybe the single most important thing determining the compliance or non-compliance of the patients. So anyhow, we treat it. Therapy combination is ideal, but if they cannot go to therapy, medications are fine. If they cannot take medications, therapy is fine. But if one of the treatment is being employed and it's not helpful, then for medication, we change the medication and we add therapy. And if just therapy, then we add medications. I'll stop for a second. Any questions at all regarding postpartum depression? Please go ahead and ask.
Dr. Khan, we have some questions in the chat box as well. So should I read them out to you?
Sure.
Can you please explain the difference, if any, between postpartum depression and baby blues?
Yeah. So as I was mentioning, that postpartum blue or baby blue, different names, is a phenomenon that happens to most of the women. That can include mood going up and down, feeling a little bit depressed, overwhelmed, feeling scared about the safety of baby. It usually lasts up to 3-4 days, maximally a week, and the symptoms are not that severe that they would impact your day-to-day life. And what is day-to-day life? Your ability to interact with the people around you, your ability to do basic, which we call ideal instrumental daily living activities, eating, bathing, drinking water, taking care of your day-to-day responsibility. So usually in postpartum blues, those would not be impacted. But if starts to get impacted, then it is being it is being converted into postpartum depression. I think one of the person asked me about the duration, as I said that. So the time period in which depression begins, and it would be regarded as postpartum depression is within 1 year of pregnancy, but usually within 2 weeks. The duration can vary. Minimum duration is 2 weeks. It can last up till weeks, months. It can last up to even years. Usually it doesn't last more than 3-4 weeks. So Kurutulan asked a very good question. So the suicidal thoughts, usually the thoughts of killing the baby, it would enter in the realm of postpartum psychosis. But potentially even severe postpartum depression cases can have it. Okay. Any other questions?
Yeah, we also have another question that as undergraduate healthcare professionals, how can we increase our understanding of those experiencing postpartum depression better and support them?
As undergraduate healthcare? Okay, yeah. Very good question. I'm really happy that you guys are asking very good questions. Again, just be mindful. For example, I'm sitting in this room. Right now, I'm focused on my screen. I'm not being very mindful about my surroundings. There's a wall, there's a clock, there's my coffee mug. Okay. So in your life, day to day, if you have a relative, significant other, anyone, parent who is pregnant, be very mindful about their behavior, how they are doing. Ask them again and again, not to an extent where you irritate them, but ask them again and again. And ask them if they are doing okay. Notice their eating pattern. Notice their sleeping pattern. Notice, are they enjoying the things they used to enjoy in the past? Listening music, let's say offering prayer, stuff like that, or meeting with friends, stuff like that. So these small things, they can be very important for any observant person, not even necessarily a medical student or healthcare worker. Anyone can notice that, and subtle to prominent changes in this can provide us very useful information.
Sir, I just have a question about the SSRI medicine. How would it affect the state of the mother? How soon do they start working?
So are you asking that what benefits would we see?
Yes, sir. What changes would we see in the mother?
So again, the changes, so the aim of giving any psychiatric or even therapy, psychological counseling or medication is to push that depression towards remission. So if they are feeling depressed, they are not able to sleep well, they are not able to eat well, feeling hopeless, crying, the hope and aim is to get rid of all of those symptoms. Once they start to show some improvement in these symptoms, then we have an idea in 4 or 5 weeks that medication is working. The other important thing is the dose adjustment. I've seen people, for example, I'll just give you a rough example that SSRIs are usually started at a small dose, and within a couple of weeks, we increase the dose. I've seen people coming to me after couple of years of being on SSRI and say that we are still depressed and their dose is just the starting dose. So we have to amp up the dose, keeping the potential side effects in mind. And once we start to see the improvement clinically, then that means that the treatment is working.
We have another question. Daino Rahman is asking, I read some studies stating that it has been found out that up to 10% of new fathers get postpartum depression, most often in 3 to 6 months after the baby is born. A new father is also more likely to be depressed if their partner...
Chahat Fateh Ali Khan, all the way from London.
Guys, coordinators, could you please remove whoever is... Yeah, thank you.
I thought actually the real Chahat Fateh Ali Khan joined us. Maybe our session is so famous.
We do have more than 130 registrations, if I'm not wrong, right now.
Okay.
A new father is also more likely to be depressed if their partner has postpartum depression. Is there any truth to this?
Well, absolutely. So we don't talk again a lot about it because usually being men, we try to tough it out. So वो जो कहते हैं ना मर्द को दर्द नहीं होता this and that. This is all rubbish. Yes, fathers can also have postpartum depression, especially if their partner is being affected. There is evidence to that. Absolutely, it's correct.
I think that's it from the questions for postpartum depression. We can continue if you will.